Behavioral therapies. So, behavior therapy or behavioral modification is based on the assumption that undesirable behaviors have been learned and therefore can be unlearned. Behavior therapists focus on the problem behaviors rather than inner thoughts, motives, or emotions. Their goal is to determine how these behaviors were learned and see if they can eliminate them. Systematic desensitization. So, one behavioral technique is to use exposure therapy, which is a process to expose people to what they normally avoid. So, if you're deathly afraid of elevators, it's to make you take an elevator. If you're afraid of snakes, it's like a fear factor thing. Jump into a tank of snakes. Obviously, not poisonous ones that won't kill you, but whatever you're scared of, it's to expose you to it. So, one exposure therapy is to extinguish anxiety is systematic desensitization. This is where a patient is exposed to an anxiety producing stimulus gradually. Over time, the anxiety will become extinguished. So, this is where you don't just jump into a pile of snakes, but you slowly work your way to it. Like first, you see a picture of it. And the key thing during this technique is you always have to be calm, right? You have to be in a calm setting the whole time. So maybe first you see a picture of it, then maybe you see a toy snake, then maybe like a dead snake in the room, then maybe a live snake across the room, and then maybe before you know it, you're holding a snake. Once again, one that won't kill you. So another exposure therapy is classical conditioning. So flooding, so used to extinct old behavior. So client has prolonged intense exposure to something that is even more frightening and intense. So a person is forced to deal with irrational fear. So this is the original one I was talking about with like exposure therapy, where kind of like the picture there, you scare snakes, like the whole fear factor thing. You get into a tank full of snakes. Aversion therapy. So aversion therapy takes on the psychological problems with a conditioning procedure designed to make tempting stimulus less provocative by pairing them with an unpleasant or adversive stimuli. So in time, the negative reaction, which is the unconditioned response, associated with the aversive stimuli, come to be associated with the conditioned stimuli. This is usually a last resort type of therapy, though it has been shown to be successful. So this is one where, so we've talked about classical conditioning, the unconditioned stimulus, unconditioned response, conditioned stimulus, conditioned response. Well, so you take an unconditioned stimulus, like, getting sick. So let's say every time you want to quit smoking cigarettes. So you put something in the cigarettes that make you sick. So therefore, every time you smoke a cigarette, you vomit. Well, that's going to make, so then you get an adversive response to smoking cigarettes. Therefore, when you think about smoking cigarettes, you're not going to want to smoke cigarettes anymore because you're going to be thinking about getting sick. So even though it's not a natural reaction to get sick when smoking cigarettes, you elicit the same response because you've paired it with something that naturally makes you sick. It also can be done with like smoke or, well, I'm talking about smoking, but like alcohol or something like that as well. So that was classical conditioning, but you can also use operant conditioning. So behavior therapists practice behavioral modification, which is reinforcing desired behaviors and withholding reinforcements for undesirable behaviors or punishing them. So pretty much when you behave properly, then you get rewarded. If you don't behave with the desired results, then either we withhold the reinforcement or you're punished in some way. And a lot of times it could be like negative punishment where you take away a privilege. So these therapies rely on the tools of operant conditioning, reward and punishment. So two different ones for this one is contingency management, which is an approach to changing behavior by changing the consequences associated with the behavior. So oftentimes this is used with substance abuse, and during this therapy, individuals are reinforced or rewarded for evidence of positive behavioral change. Next is token economy, which is a technique involving the distribution of tokens or indicators of reinforcement contingent on desired behaviors. So like every time, you do something positive, you get a token and then you can cash them in. So it's all about positive reinforcement. Cognitive behavioral therapy. This therapy combines a cognitive emphasis on thoughts and attitudes with behavioral strategies. All right, this approach assumes that an irrational self-statement often underlies maladaptive behavior. So this is the combination, of cognitive and behavioral together, which is the more modern approach. Thinking that, if you think negatively, well, that's usually going to lead to negative behavior, and negative behavior usually, makes you think negative. So they work together and we need to change both. All right, last slide. So in this form of treatment, cognitive behavioral therapy, the therapist and client work together to modify irrational self-talk, set attainable behavioral goals, and develop realistic strategies for attaining them. In this way, people change the way they approach problems and gradually develop new skills and a sense of self-efficacy, which is one's belief in his or her capacity to execute certain behaviors. So pretty much how well they feel they can do things.